Assalamualaikum and hi everyone. So before we start our presentation, I would like you guys to guess about this picture. So what you guys can guess? In my opinion, I think this picture is talk about someone is smoking a cigarette. If you want to know more about smoking, let's we move on to the next slide. Firstly, I would like to give a definition of smoking. What is smoking? Smoking is a practice in which a substance is burned and the resulting smoke breathes into the blood. Most commonly, the substance is the dry leaf of tobacco plant have been rolled into a small piece of paper and become a round cylinder that called as cigarette. The term cigarette is commonly used to refer a tobacco cigarette, but sometimes it used to refer the other substance such as cannabis cigarette and shisha.
My name is Siti Maisara binti Abdul Hamid and my matric number is 11D8020F1046.
My name is Fatin Fatihah binti Muhammad Hanafiah and my matrix number is 11D8020F1025. Our presentation will start with introduction of smoking, next causes of smoking, and we'll continue to explain about bad effect of smoking, tips for stop smoking, and last but not least is conclusion for this topic. So let's we continue with our presentation.
Okay. First, I will explain the factors of smoking. Okay. The first point is the peer influence. Peer are very influential in our daily life everywhere. We are also easily influenced by new things that we have never done. And the thinking of today's teenagers say that if they smoking, it show they are mature, but they do not know the adverse effect on their own health. Okay. And the second point is family problems. Family problems can also put us under pressure. And to relieve the stress of today's teenager will find something that makes them feel careless or want to calm down without thinking about the bad effect. And the teenagers or individuals thinks by smoking they feel that they are calm, then there no need to think about other problems. And this is also due to the lack of parents attention by the parents themselves. They are busy working without monitoring their children's movement. Okay, and the last point is also attract the attention of people to try smoking. Like local cigarette distributors encourage the public to smoke cigarette as it is a source of income. But the public does not think of the effect on themselves and others. By seeing other people smoking cigarettes, the individual also wants to try. Then that there is an attitude easily influenced by the surrounding situation. Okay, now I will explain with you what effect of smoking in our healthy. The first effect is lung cancer. Smoking puts you at significantly higher risk of developing lung cancer. Lung cancer is the most common cause of death due to smoking. According to the CDC, it's also the most common cause of cancer death in both men and women. Okay, and second effect is unhealthy teeth. Okay, yellowish or brownish stain on the teeth are telltale signs of long-term smoking. Smoking also increases your risk of infection or inflammation that can lead to tooth and bone loss. Okay, so our teeth. And the last effect is reproduction. Men who smoke are more likely to have damaged DNA in their sperm. This can also reduce fertility. Pregnancy complications. Smoking is known to cause ectopic pregnancy, a condition in which the fertilized egg fails to move to the uterus or womb and instead attaches to other organs outside the womb. In men, there is clear evidence that smoking results in fewer and less motile sperm as well as a lower proportion of normally shaped sperm. However, it remains unclear whether this impairment in spermatogenesis results in clinical impairment of fertility. Okay, now I will give you tips for stop smoking. Okay, first, set a quiet date. Choose a date within 2 weeks so you have enough time to prepare without losing your motivation to quiet. Okay, so if you mainly smoking at work, quiet on. Okay, the quiet on the weekend so you have a few days to adjust to the change. Okay, secondly, talk to your doctor about getting help to quiet. You must talk to your doctor can prescribe medication to help with withdrawal symptoms. If you cannot see a doctor, you can get many products over the counter at your local pharmacy, including nicotine patches, lozenges, and gum. And the last tips is remove cigarettes and other tobacco products from your home, car, and work. Okay, throw away all of your cigarettes, lighter, ashtray, and matches. Wash your clothes and fresh up anything that smells like smoke. Shampoo your car, clean your drapes and carpet, and steam your furniture. Okay, now I tell you what the value we get if we quiet smoking. Okay, so the first is thrifty. Okay, if we stop smoking, the money we usually buy cigarettes, we can save to buy other necessities. Second value is responsibility. Okay, the responsibility. The individuals here is responsible for avoiding cigarettes so that they can protect the environment, avoid pollution. Okay, and the last value is discipline. The individual must discipline himself to quiet smoking because it is harmful to health. Thank you. And therefore, parents need to monitor their children from taking things that should not to be. And the beginning of smoking, but most likely without supervision, it can take more than that, like drug or neglectful objects.